Hey guys, this is Dr. Carl Baird at Evolve Performance Healthcare. Today we're going to go over some of our favorite treatments if you were involved in a car accident and are experiencing neck pain. Again, neck pain is one of the most common symptoms that people experience after a car accident. It's usually a result of whiplash. So again, our head kind of coming back and then coming forward damages some of the muscles and some of the joints. So what we're going to do is give you some treatments, things that we do here in the clinic to 1, restore range of motion, 2, decrease pain, and then we'll follow it up with, again, some exercises to start rebuilding strength and stability in that neck for sustainable pain relief after a car accident. So the first technique we're going to do, it's a muscle energy technique to help restore range of motion. So if you've been in a car accident, you know that a lot of times our range of motion gets limited as the body tries to, again, protect those joints and heal all the muscles. And so what we're going to do is, this is Brittany. She actually wasn't in a car accident, which is a good thing, but we're going to pretend she was. And let's say she's going to turn to the right. And let's say ideally we'd want to see her nose over her collarbone, or about 80 degrees of neck rotation. But let's just say after a car accident, she's right here. She's at about 40 to 50 degrees rotation, and we want to get a little bit more. So a lot of times what's restricting that range of motion is, again, just tightness in these muscles. So this technique is called post-isometric relaxation, and all we will do is we're going to have her turn just as far as she can go in a pain-free range, and then from there I'm going to hold her head and we're going to have her very lightly. So if we're talking about contraction, there's 100% contraction, we're going to have her go, 10 to 20%, just really lightly. Try to turn her head back to the left or back to center. And so go ahead, Brittany, just turn to the left. Good, a little bit harder than that. Good, there you go. And we're going to hold it for 5 to 10 seconds. And then we relax, and then have her turn to the right a little bit more. And what you notice is those muscles on the left side, after they contract, they relax and allow you to turn a little bit more to the right. So we do that for all the range of motion that we're lacking. So again, rotation, you can do it for lateral flexion or bending to the right and left, and also flexion extension. So that's kind of treatment number 1, just soft and gentle. The next, we're gonna have her lay down, and we're gonna do, again, a chiropractic adjustment. So again, the other thing that gets injured after a car accident are those joints. Same mechanism of the head coming forward and coming back. The joints in the back of the neck get compressed and irritated, and what the adjustments themselves do is they help gap those joints, which helps decrease pain and, again, improve range of motion. So again, it's very simple, but all we do is we look and feel for areas that might get stuck. So again, after a car accident, a lot of times what happens is these joints go on lockdown because they're trying to protect the area from injury, but it actually ends up hurting us a little bit more when we don't have that full range of motion. So Brittany's a little bit stuck right here. So all we're going to do is just a quick adjustment, bend her to the left, turn to the right, and good, and back down. And are you still with me?
Yes.
All right, she's there, great. All right, so we're going to go both directions. We're going to come back to the left, relax that muscle in, turn to the right, good. And that's it, that's the chiropractic adjustment. So the last thing we're going to do is again, do some soft tissue work on specific muscles. So after a car accident, there's typical places that tend to get injured. One of the more common areas, they're called your suboccipital muscles. They're right kind of at the base of our skull, right as the skull transitions down into the neck. And so we can work on those just by turning the head slightly to the left, and again, she can be completely relaxed. And again, we find them just at the base of the skull, right there. And again, you can do just soft tissue massage, you can do trigger point work, you can do a little bit of transverse friction massage, but the idea is, again, just helping decrease pain as well as helping these tissues heal in the right area. Another area that often gets injured are your upper traps. So again, just more soft tissue work, kind of up here into the shoulders as these muscles transition to the neck. Upper traps, also levator is kind of top of the shoulder blade up into the neck. And then again, really all around the neck you can work on your scalene muscles, you can work on your SCM muscles. And just again, spending some time, soft tissue massage, transverse friction massage, trigger point work, anything like that. So that's what we do in the office, and then we always follow that up with exercises, which will be shown in the next video. And that's it.